Hello. Our teaching plan today is how to teach a teenager that just got diagnosed with diabetes how to take care of themselves. This is going to be by Courtney, that's myself, Lindsay, Julie, and Shelby. I will be talking about the background on type 1 and type 2 diabetes. What is diabetes? How your body turns food into energy. When you eat a carbohydrate, your body turns that into a sugar called glucose and sends that to your bloodstream. The pancreas releases insulin, a hormone that helps glucose with your blood into your cells and uses it for energy. If someone with diabetes has no treatment, his or her body will not be using insulin like it should. Too much glucose in your blood is life-threatening and can kill you. Type 1, also called insulin-dependent diabetes, begins in childhood. Why some people could get this? Genes could cause this type of diabetes, or else there is a problem with the cells in your pancreas that make the insulin. Type 2 diabetes, also called non-insulin dependent, 90% of people have this type of diabetes. It usually begins later in life, around teenage age. Why people can get this type is that the pancreas is creating insulin, but either it's not enough or else the body doesn't use it like it should. Thank you.
Hi, my name is Lindsay, and I'll be discussing how diabetes affects teenagers. According to the National Institute of Health, more than 200,000 children and teens were diagnosed with diabetes in 2017. More teens each year are diagnosed with diabetes and could potentially affect their health and for the rest of their lives. Managing a teenager's new disease can affect their daily lives and vital developmental phases like independence, accountability, and self-esteem. Excuse me. Teenagers want to fit in and don't want to be responsible to check their blood sugars consistently, so teens may refuse or they may forget to check their blood sugars. This can affect them in the long run and manipulate their insulin doses. They may manipulate their insulin doses in an attempt to lose weight or avoid weight gain. This can lead to diabetic ketoacidosis, which is accumulation of dangerous substances called ketones in the blood and urine. This could also lead to amputations, blindness, and worse complications with their kidneys.
So our goals for the teaching project is that the patient will gain a basic understanding of diabetes and how to care for themselves with the lifestyle changes that need to be made, and also that the patient will be able to check their own blood sugar levels and administer insulin per the sliding scale. Our learning objectives are the patient will be able to describe the signs and symptoms of hypoglycemia and the treatment of hypoglycemia by the time of discharge. The patient will be able to test own blood sugar and give own insulin per sliding scale by the time of discharge, and the patient will be able to pick diabetic appropriate meals without the help from the nurses or the dietitians also by the time of discharge.
So let's begin. Let's practice. Let's say that your blood sugar this morning before breakfast is 175. Per your doctor's parameters, they want you to take 3 units of Humalog insulin. So let's go ahead and take an alcohol swab. We're going to open that up. Make sure your hands are clean. You're going to clean the top of the vial because you always want to clean an opened vial, even if it's yours. You're going to go ahead and open the insulin needle, and you're actually going to get the syringe yourself, and you're going to draw back 3 units. 1, 2, so there's 3 units of air there. You're going to put that air into the insulin vial. You're then going to keep the needle in the insulin vial, and you're going to draw back the 3 units of insulin. So the biggest, most important part of this as well is to make sure that there's no air bubbles in the insulin vial below the line. And I will show you that. 5, 4, 3. Okay, so we have 3 units of insulin, okay? And then you're gonna take it out. You can flick the syringe just to make sure that there's no air bubbles in there. Pretty simple, right? Okay, so now it's time to administer. So what you would do then is take an alcohol swab and administer into your abdomen or the back of your arm, like I previously said, and you're going to insert the needle at a 90-degree angle into your abdomen. You're gonna clean the area and make sure you're at least 2 inches away from your belly button. You're gonna push the needle all the way until the needle retracts. Okay? I know that can be scary for some teenagers, especially wanting to poke yourself 3 to 4 times a day, having to check your blood sugar, but this is so vital for your health and for the longevity of your life as well. So it's your turn to try it. Ready?